My name is Paul Notar. I'm a Senior Associate Director of International Admission with the Admission Office at MCPHS, Massachusetts College of Pharmacy and Health Sciences. I'm here with Mona. Mona is a graduate of the PharmD, Doctor of Pharmacy program at MCPHS. She's going to tell us about her experience. Mona, why don't you tell us a little bit about your biography, like prior to MCPHS? What did you do? Where did you study? And what got you interested in pharmacy?
Sure. Thank you for having me today. I'm originally from Iran. In Iran, my background is I'm from a religion of Baha'i. So Baha'is in Iran don't have the usual or traditional channels of education. I had to study my pharmacy in the pharmacy school online with professors from around the world, from Canada, United States, Japan. So my love for the pharmacy grew in Iran while I was in the pharmacy school for the Baha'i students. Then life happened. I got married and I moved to Canada. Um, in Canada, I asked the pharmacist to shadow her to see if I still want to be a pharmacist, because so many people told me that pharmacy is different in North America than in Iran. I shadowed that pharmacist and I still wanted to become a pharmacist. So I started studying cell and molecular biology in Concordia University in Montreal. I loved it, to take all the prerequisites, but still I didn't know that I can go to United States and get my PharmD over there. I was studying and I was communicating with so many schools, not so many, there aren't many schools, pharmacy schools in Canada, with some of them, but it was really hard to get in to those pharmacy schools because they have, in Canada is different. It's based on the place that you live in. So I didn't have that much of chance. And I was living in Quebec, in Montreal. I didn't speak French. I wanted to be close to my family. And suddenly one of my friends suggested MCPHS. And I communicated with the people, with MCPHS people. It was really encouraging, and it opened the door for me. So I had the chance to talk with one of the associates who moved, who came, like people from MCP. I don't know who are those people. The admission people that come to Montreal. They came to Montreal. I had the chance to talk to them about the MCP, and so I chose MCPHS to study my pharmacy. I hope that I answered it.
Yeah, that's great. That's really helpful. Now, do you think that your experience or your career would have unfolded differently had you stayed in Canada and gone to pharmacy school in Canada? How would that have been different?
Definitely, definitely. And um, I don't know how to say it. I'm always thankful to Canada for giving me. Canada was my second home. I love it. I'm thankful for the opportunities that they gave me, but I would never go back to that. MCPHS opened so many doors for me, and um, there are so many opportunities in the United States for work, to grow professionally, especially, um, which I really like.
Yeah, talk about that a little bit. So you came to the United States, you did the accelerated 3-year Doctor of Pharmacy program in Worcester, Massachusetts. You did clinical rotations. You did, I believe, your final year at Yale Health System. Talk about just what you were exposed to as part of the program and part of the rotation.
So that last year of the pharmacy school, so in a Worcester campus, we are accelerated. We have 2 years of studying, and the last year is 8 months of practicing pharmacy, which is preparing you for the job that you're going to do after graduation. That was really amazing. So the second year we had the EP rotations that it's community and institutional that introduce the pharmacy students to the like the different job positions or job opportunities, but it's still small. But when you go to the APIs, the last year, MCP has a great program. It's longitudinal programs. I know that there are some other stuff for the fellowship. I didn't follow that because I always wanted to be a clinical pharmacist, so I didn't follow that. But the longitudinal program for the health systems, it's with different hospitals that the pharmacy student has the opportunity to do the whole program, like the whole last year in one health system, get to know different part of that health system, get to know the people, make connections, because as always, everyone in the pharmacy school says, pharmacy world is small. So it's really important to have a good connection with people and make a good impression. So I did the last year at Yale, and that was amazing. It was really hard. But I did it with a baby, not with a child, not baby at that time, but I did it with a child, so everybody else can do it. I'm a second language speaking English. I'm immigrant. My husband didn't have a job at that time. My baby was small. I was able to do it. So I'm sure everybody else can do it. Uh, if you like the job, if you like the pharmacy. Pharmacy is a beautiful, I love it. Every time I talk about it, I'm like my heart. I'm so happy that I was lucky to be in this path, to find this path and be where I really want to be. So my longitudinal program at Yale was they call it a mini residency because they ask you to do so many things, but it truly prepared me for my job. It made me a pharmacist. So I'm thankful for that.
How did you
Yes.
get that? How did you get that mini residency? Was that organized through MCPHS?
Yes. So there are, if you're a student at MCPHS, every week there are people that come in from the faculty, from different associations in the pharmacy school that they come and talk to you about the opportunities. So these longitudinal programs are introduced throughout the years before.
Mm.
You are familiar with it, you have to do the application for it. And there are so many people, so many faculty members, professors that they help you through that to make your application, to send you a recommendation letter and this stuff. So you can get this. It's a competitive application, and because so many people, they want to do it. So you can get into that program. I think it was a really good opportunity. And I know that for fellowship people, they have something like that in the industry part, but I didn't go to
I
that.
think I think a lot of especially high school students would probably be surprised that you can pursue like an oncology type of specialization as a pharmacist because they think of a lot of high school students that I speak with think of these types of specializations as being for medical doctors. Um, what do you think about like what advice would you have for a high school student who's clearly interested in biology, chemistry, maybe likes the idea of working in a hospital setting, but hasn't really explored pharmacy too much? Any thoughts, any tips?
Definitely, they should explore it. I think something that before pharmacy school, so many people told me, they were like, oh, why pharmacy? Pharmacists don't have jobs. So I'm going to tell this here. I told it to everybody else. This is a lie. This is a lie. There is an increasing need for a pharmacist in every healthcare setting, even in clinics, because pharmacists, how should I say it? I think pharmacists are the backbone. They're in the backside. You don't see them, but they take care of so many things. we take care of the dosing, the right dose, the right patient, the right medication, and the right route of administration. All these things are taken care of by the pharmacist. Dosing the medication is something that we do it a lot, making sure that the compounded medication is the right medication, the right amount. I think somebody who wants to go to the field of healthcare should think that how they see themselves. Do they want to be in direct contact with the patient, or they want to be in the back? Because in the field of pharmacy, you have the opportunity to be in direct patient care, indirect, like be in the back, don't see the patient, or go to the industry. So I think pharmacy opens a lot of doors for the someone who wants to be in healthcare system. At the same time, they don't want to spend that much of time. I can't say it. It's my experience. So I can say my experience. I wouldn't go to the medical school. I didn't go to a medical school because it was too many years for me. This is one reason. I didn't go to a nursing school because I couldn't be in that close contact with the patients. I'm too emotional. I can't do that. But I wanted to be in the pharmacy because as a pharmacist, you are taking care of the patient, but at the same time, you're taking care of yourself too. I think
Yeah,
I
that's a
like.
really good way to put it. That's a nice way to put it.
Yeah, and also you become specialized. Right now I have a friend who got into the PGY2 of cardiology. So she is a cardiology pharmacist. I'm oncology. I have a friend who is in critical care. So we are becoming more specialized. As I told you, that the need is increasing, and pharmacists are becoming more specialized in each field.
That's great. So what's next for you? So you've been really successful. You're a pharmacist. You've been working for a little bit now. What's next professionally for you?
Definitely, I will be looking for getting trained to become a clinical oncology pharmacist. So I'm working on that.
What does that mean exactly?
So clinical oncology pharmacist takes care of the side effects, the dosing, and the direct communication with the doctor regarding the dosing of the oncology medications. Right now, I'm operational, so I take care of preparing the medication for the patient. So when the clinical oncology pharmacist verifies that this is the right medication, the right dose, the right time, and the right patient, I make sure that the right medication with the right volume is made by the technician at the right situation. It is sterile, everything is compounded correctly, and is being sent to the patient. And I also have to make sure that it should be in the fridge, it should be in room temperature. We have to protect it from the light, or all these things. What is the BUD of the medication, and beyond use date of the medication, and these things.
Well, this really concludes everything. Thank you so much, Mona, for being with us. Do you have any parting thoughts for aspiring pharmacists or aspiring health sciences practitioners, and any parting thoughts about MCPHS and kind of your experience with the university?
I would say that don't be afraid. Don't listen to others when they try to discourage you. If this is your path, something that my mom told me. My mom said that, Mona, you always wanted to become a pharmacist. If they're saying that you are not going to have a job, who cares? You are going to find a job 3 months after your graduation, 4 months after your graduation, but do what you were meant to do. So this is to those people who are not sure. And something that they can do is that they can go and ask a pharmacist to shadow them. Something else, MCP offers you an accelerated program, which is really unique. It also offers you so many opportunities for the job and for your profession, which I think it's a really important aspect to consider.
Thank you so much for joining us, Mona. We really appreciate it. We wish you the best of luck.
Thank you. Thank you for having me.